When a stroke changes everything, hope and healing can be closer than you think. Right here in Southern Indiana, PAM Health is transforming the way patients recover, offering a world-class rehabilitation experience built around you. Today, we are sitting down with Whitney, PAM Health's Director of Strategy and Integration, and Kelly, one of their dedicated physical therapists, to talk about what makes their stroke recovery program truly one of a kind. Ladies, thank you so much for joining us today.
Thanks for having us.
You know, this is so important. I feel like every other week we are talking about stroke prevention, but if one happens, how do we recover from that? And, you know, every stroke is different too. So how do you really individualize that care and that recovery process for people?
Exactly. Just like people are different, strokes are different depending on the area of the brain that's affected, how severely it's affected, and honestly, your baseline health and habits can play a role in how severely the stroke affects you and how your recovery process goes. So we have a team of healthcare professionals that are highly trained that work together to find out where the individual is, where they were before, and where they want and need to be to get back home with their loved ones.
Most importantly, right? They just want to get back
Yes.
to everyday life. This is the weekly theme of PAM Health. Like, we love that you're a patient, but we also want you to get on with your life too, back to what it used to be. And so what makes your stroke recovery program just so unique, and how does that really, you know, get your patients back to regaining that independence?
So our program is unique because it starts with our clinical navigators. Kelly is a doctorate degree in physical therapy, and she's practiced direct patient care for years. She is now one of our clinical navigators. So she is seeing the patients at the hospital, at bedside, right after their stroke when they're planning their discharge from that level, or even maybe at home. Maybe they went straight home from the hospital and they haven't done well. So we have an expertly eyes on them at the beginning, and they're able to do an assessment and communicate that to our internal team. So our internal team, our therapist, speech, occupational, physical therapy, our PM&R doctors, our nursing staff, our respiratory therapists, they're ready for that patient. So that individualized treatment plan begins with our clinical navigators who are trained to know what we need to prepare for on the internal side once a patient admits to us, so we can get them home.
It's just incredible every single time that you guys come on the show, the amount of teamwork that goes in this. I mean, I've heard, you know, stories before where you're just in the hospital and then it's like, oh, you're good, off you go. But no, it's like you want to keep in touch with them. You want to make sure that they have the best possible outcomes, not only teamwork inside, but also the exterior, which is typically family. So how do you really involve family members in this whole process as well?
So yeah, nobody goes through life in a bubble, and it's very important that the people that have been your support system when you were doing life before the stroke are involved in figuring out what's new and what's different and how they can help you after the stroke. And so we encourage family to be present from day one, learning about, you know, what is a stroke? What's happened to my loved one? How are things going to be different now? And how can I help them recover? And so we do a lot of hands-on family training. You know, people may be using new equipment to them that they didn't use before and able to be successful. And so we just want to make sure that not only that the individual affected by the stroke, but that their whole family, because they've been affected too. We want them to be able to help and support them as they continue to recover.
Yeah, going back to that internal team, it sounds like, you know, occupational speech, physical therapy, they work hand in hand. So how does that really maximize that recovery?
Absolutely. Our therapy team works very closely, not just with the patient, but with each other. You know, they all have their own strengths and skill sets. A physical therapist is going to work more on just helping make sure the person is stronger and that they have the balance and the coordination and just the actual flexibility and range of motion they need to do things day to day. The occupational therapist is going to hone in on how do I use those to develop my skills so I can do everything from like make a cup of coffee to get on and off the toilet or get dressed in the morning. And then the speech therapists are experts in helping to, you know, regain those communication skills, because sometimes that is affected. Sometimes your ability to process and sequence things is affected, and sometimes your ability to eat and swallow is affected, and so they help with that as well. So.
Yeah, so many, you know, ways to help your patients, and it's all comprehensive. Like, you are there from the moment they get there to the moment that they get to go home finally. So thank you ladies so much for coming on today and every single Wednesday. We really appreciate you guys.
Thank you.
All right, to learn more about not only their stroke program, but everything else that PAM has to offer, just head over to PAMHealth.com. pam.com.